Hey guys, welcome back to the Pulling Curls podcast. Today on episode 119, we're talking about something. Okay, so I'm not like super earthy-birthy, but this is something I recommend fairly frequently. Sometimes I get wide eyes, but today we're going to untangle chiropractic care in pregnancy. Let's go. Hi, I'm Hillary Erickson, the curly head behind the Pulling Curls podcast, where we untangle pregnancy, parenting, home, and even travel. We know there's no right answer for every family, but hopefully we can spark some ideas that will work for yours. Life's tangled, just like my hair. Okay, guys, before we get started, I wanted to share a review from Sleepy Sarah. She said, such good information. I'm 36 years old and 34 weeks pregnant with a miracle IVF baby. It's my first, and I've avoided a lot of conversations and situations about pregnancy and labor and delivery over the past 5 years. I bet a lot of you were like that also. Now that it's finally my turn, I found her online prenatal class, which my husband and I are both enjoying on my own. I've been a binge listening to all of the episodes about pregnancy and being a mom of an infant. I love the podcasts are relatively short and they're so practical. Thanks, Hillary. Guys, I love reviews so much. If you guys could leave me a review, I will sprinkle all of the good nurse karma all over you and you will shine bright like a star. Leave me a review. Okay, I met today's guest on the Tickety Talk, which is where I meet all of my friends. She just had so much good information about chiropractic care during pregnancy, because a lot of times people veer very earthy-birthy and like, your chiropractor is just going to deliver your baby, which they are not. If your chiropractor says they can deliver your baby, that's the time to leave. But I do believe that chiropractic care has a place in pregnancy, and I definitely recommend it if you have a breech baby. And I had some revelations during this interview, so I can't wait to introduce you to Alyssa Hickey. She is a chiropractor in the Rochester, New York area. Do you feel prepared for your delivery? In just 3 short hours, you can be prepared for the confident, collaborative delivery you want. You'll know what to expect and how to talk with your healthcare team, and there are no boring lessons in this class. I'll use humor, stories from my 20 years in the delivery room to engage both of you. I love how Alyssa told me that she found herself laughing at things that used to sound scary. Most of all, you guys are going to be on the same page from bump to bassinet. Join the online prenatal class for couples today. You can save 15% with coupon code UNTANGLED. You can find the link in the show notes. Hey, Alyssa, welcome to the Pulling Curls podcast.
Thank you so much for having me.
Okay, so I saw Alyssa on TikTok. She's so bubbly and like fun. And you guys know that some chiropractors maybe turn off the nurses, but she didn't. I think she really practices in a way that really enhances the rest of your pregnancy.
I love that. Thank you.
Yeah. Okay, so chiropractic care in pregnancy. Can you deliver a baby? Let's just start off with that.
No.
I mean, anyone can deliver a baby. You just pull down, release the shoulder, and pull up. Honestly, they're but it's not part of a chiropractic like education, obviously, right?
No, not at all.
Do you guys talk about pregnancy much in regular chiropractic school?
I think it depends on the school that you go to. The one that I had gone to didn't really touch on it that much. They were more of like a sports-based chiropractic school. So a lot of my training came afterwards, just with continuing ed credits that I had taken.
Okay. Yeah. And I think that's something important, because I think a lot of people contact their local chiropractor and they're kind of like, I don't do pregnancy. And that's pretty normal, right?
Yeah. So the other thing is too, I feel like a lot of chiropractors do claim to do pregnancy because you learn a little bit when you're in school, and you don't have to technically have a specific certification or specialty to be able to treat pregnant women. But it is the Webster Technique, which is the more specific technique for pregnancy, is so amazing. And a lot of my patients that have seen like other chiropractors and eventually come in are like, okay, this is completely different than the treatment that I was getting before.
Yeah. So if you like, obviously if you had like an earache or whatever you were normally going to the chiropractor, then that would still be safe during pregnancy, right?
Yeah.
Like neck issues and those kind of things.
Yeah. And regular chiropractic adjustments are completely safe during pregnancy. It's just if you can find someone that does specialize in it, your treatment is going to be different. And I think you're going to feel a pretty big change with it, because it can affect, you know, the way that you're caring throughout your pregnancy. It can affect the whole laboring process and then also postpartum healing.
Oh, wow. Okay. Let's talk about it. So what can it do while you're like pregnant?
Okay.
Do you recommend people come the whole pregnancy?
Yes. So I typically tell people to start coming even prior to getting pregnant. If you're having trouble conceiving, chiropractic can be really great too, just to kind of help balance out that pelvis, increase blood flow, nerve flow to all the reproductive organs. Oftentimes I know before the father or partner knows. And then, some people are a little bit more nervous throughout that first trimester anyway, but I typically recommend people, once you find out that you're pregnant, to find your Webster certified chiropractor and start going early on. Because the thing is, if you wait until you start to have pain or discomfort, it's a lot more difficult to correct the issue, and it's going to take longer. And you're going to have to see us more frequently to get some of that inflammation out and get those joints and ligaments back to where they should be so that you can be comfortable again.
Okay. Joints and ligaments. I know a lot of people are just like, I am miserable at 40 weeks, but it really is. Your joints and ligaments are just so over this weird body positioning you now have because of this baby, this watermelon you're carrying on your belly, right?
Yes, definitely. And I think a lot of times people don't realize either is, that first trimester is when you really start feeling it and you're not really telling anyone. So you're like, I can't go to the chiropractor because I don't want people to know that I'm pregnant and I don't, you know what I mean? So I think people get nervous with that and they're like, what's going on? I shouldn't be feeling this early. But the thing is, your hormones change so much. So that's going to affect those ligaments and muscles because you're going to have a huge influx of that relaxin, which is going to start loosening everything so that your body can make this change for the baby. So then you're really going to start feeling that. And then your center of gravity is going to start getting off. So that's going to affect your biomechanics. So there's a lot of different changes happening. So it's just really great to find someone that can go through, optimize that pelvic alignment so that you feel your best throughout the whole pregnancy and while your body is growing and baby is growing.
Yeah. And I think a lot of people don't realize that just when that center of gravity shifts even just a little bit, just as you start to show, I mean, obviously when you're 4 weeks, your center of gravity hasn't shifted a whole lot.
Yeah.
But you start to show, you notice a pooch in the mirror, your pelvis is starting to be like, what the heck?
Mm-hmm.
Like what's going on here? And that was stupid relaxin. So my pelvis split with my last baby and I talked to like all the OBs and I mean, I was a labor nurse at the time and they were just like, yeah, that's too bad.
I know. And I think, so did you have a pubic bone separation?
Yeah.
Yeah. So, and I think that that's a big thing too, that I try to educate my moms on early on, because there's a lot of movements that you typically do. Like just think of getting out of the car. You swing one leg and then you swing the other. And when you're trying to roll over in bed, you swing one leg and then the other. And that puts a lot of torque on that pubic bone. And if you've got relaxin in there, that's loosening everything. And then you have some inflammation because it's slightly inflamed. Inflammation is going to loosen that joint. And then that quick movement, that's all you need. And then it takes so long to get that inflammation back down. We got to do certain exercises, icing. I have to adjust it, have you come in a bunch, and we eventually can get it to go down. But if you start early on just making those changes, then you can prevent it.
Yeah, that would have been a huge change. Also being a nurse, like it was just a joke, like pushing beds.
Yeah.
It was
moving people, lifting things. Nurses, I feel so bad for them. Trying to get compression socks over those swollen ankles.
Oh, compression socks. I don't miss them. I'm not going to lie. Okay. So chiropractic can help with all the main things that you would normally go to a chiropractor before. Do a lot of people come to a chiropractor just during pregnancy, or most of them have seen you before and then just continue?
I think in general, a lot of people go to a chiropractor without being pregnant, but at my office, since that's what I mainly like educate and post about, a lot of my new patients come in being pregnant.
Okay. Awesome. Okay. So we start early on and then kind of just what is the Webster method? How does it differ from regular chiropracticness?
So the Webster Technique is a specific technique in training through the ICPA, which is the International Chiropractic Pediatric Association. And like I said, it focuses on targeting certain muscles and ligaments that are known to get tight throughout pregnancy to help balance and optimize that pelvic alignment. So a chiropractor that does the Webster Technique typically they'll have like a table that either drops down for your belly, or they'll have like a pregnancy pillow for you to lay on. So you get to lay on your belly. They're going to go through and assess how your sacrum is moving, which is at the base of your spine. So that triangle bone down there. So a lot of times, a lot of our moms experience pain around those like back dimples, those SI joints. So they'll go through and assess how that sacrum's moving. And then they'll work on like the piriformis muscle, which is usually what gets tight when you start to get sciatic pain. And then they'll focus on different ligaments back there, like the sacrotuberous ligament, which is down on like near your sit bone, help release all of that to open up the pelvis, create more room for your uterus to get into a better position, increase that blood flow, nerve flow, flip you over. They're going to stretch out the psoas, which is one of your hip flexors. So that gets really tight as your belly starts to pull forward and you get more of that anterior pelvic tilt. Work on the round ligaments. So a lot of times moms will feel that round ligament pain because the uterus is shifting to one side or the other. And then also check out the pubic bone.
Yeah. So that really encompasses so many problems. People come to us in labor and delivery.
Yeah.
Round ligament pain can feel just like the baby is going to come out.
Yeah.
I know it's very painful, but people come in and I'm just like, you could try like a heat pack.
I know it's really hard. So we try to educate a lot of our patients that come in too on different things they can do at home. I always give my moms different exercises that are safe for each trimester to go through and work on, give them some suggestions to get their partner involved. And then also just showing them techniques to help relieve some of that tension within like the round ligament, pubic bone, stuff like that.
Yeah. So how frequently are people seeing you? Like, are they seeing you monthly? How much time would people have to devote to this?
Throughout pregnancy, it's definitely specific for the patient. So you being a nurse with having pubic bone dysfunction, I would probably be seeing you a lot more often than I might be seeing a mom who doesn't have as physical of a job. But it's totally dependent because the thing is, if someone had a past history of an injury or an SI joint issue, a lot of times those things are going to come back during pregnancy when your body's making these changes. Typically, though, we'll see, it is very dependent. So I hate to give like a specific time, but I will typically see them once a week throughout.
Okay.
If they're doing really good, we can space it out a little bit more, but I like to kind of keep it at that, especially once you get to that 30-week mark.
Obviously. Yeah.
Yeah. And then if baby is breech, there's a lot more pelvic imbalances going on. So then I would be seeing mom a lot more frequent if we're trying to open up that pelvis so that baby can get into a better position.
Yes. And now we get to what I've always recommended people come to see a chiropractor. And of course, they don't come to see you until they're like 35 weeks when they've tried a version and it didn't work and they're laying upside down on their ironing board trying to get the baby to flip. So I send people all the time to a chiropractor for breech babies. Is it helpful at 35 weeks?
It can be, but not as helpful as if you come earlier because baby gets so big at that point. So I definitely, if baby's breech, we got to try and get mom in a little bit sooner. And I like to just say this too, because I think a lot of people are like, oh my God, you're going to turn my baby. Chiropractors are not touching the baby. They're not doing anything like that. They're just working on mom's pelvis to open it up so that if baby's able to turn, they're going to get into a better position.
Yeah. So if you're like 30 weeks and baby doctor scans it and says, baby's still breech, I think that's a great time to be like, you know what, let's just touch base with a chiropractor. Because I've seen it be so beneficial. I've actually seen people who went for like 1 or 2 visits and the baby flipped frequently.
And I've had that happen so many times. I can't even give you an exact number because it happens very frequently. And like, then I might not see mom. She has a great labor and then she'll end up messaging me when baby's like 2 and be like, oh, baby had a fall and is doing this weird walking thing now. And just so you know, my baby flipped. I had this natural birth, and it's amazing. It's really cool to be able to have those success stories.
Yeah. And if you're listening and you're not like a chiropractic fan, I'm right there with you. Like I've seen a chiropractor and it wasn't, so I saw a chiropractor after I had my baby and he wasn't super helpful. I mean, the pelvis just had to heal and I was just a mess of pelvicness. But I think for breech babies and during pregnancy, I am a really big advocate of let's get those muscles and joints as happy as we can. Mm-hmm. Because if you stay hydrated and you have happy muscles and joints, you really are going to feel so much better and totally worth the money to see a chiropractor, right? And
I think that's a common concern with a lot of people too, is people have seen a chiropractor in the past and maybe not had a good experience. So I always just encourage everyone, everyone does practice differently. So you just need to find someone that you work well with and that you feel like you're getting beneficial care from. So you just got to shop around a little bit, just like you would for any other provider.
Yeah. Okay. So if people are looking, they're like 25 weeks and their baby's still breech or whatever, or they just feel miserable. So can you just look up a chiropractor with the Webster Technique? Is that the best place to just start with a Google, your hometown, Webster?
So what I would suggest is if you go to icpaforkids.com, but the number 4, not spelled out, for icpaforkids.com, you can type in your zip code and then it'll give you a list of different chiropractors that are certified in the Webster Technique. And I always suggest go look at the website, see if it feels like someone that it's an office that you feel comfortable going to, like someone that you would feel comfortable with.
Yeah. So I would guess insurances probably don't cover weekly visits during pregnancy. Do some?
Oh, no, they do. Yeah.
Oh.
I think it probably depends on the state and like what insurance plan. But yeah, no, they'll cover it.
That's amazing. I mean, most insurances I've had have said like 12 visits a year or something like that.
Some do that. Some you can kind of go through, do some reevals and give them some like different scores of different things to show that you're getting progress too.
Yeah.
So I think it just depends on the insurance plan. But again, same thing. I think that it is just something that's so beneficial. So if you're able to just save up money towards it to have the birth that you really would like to have, I think that having a Webster certified chiropractor on your team is really beneficial. I've had a lot of moms too that, I've seen them for the second or third pregnancy and they're like, I wish I knew about this for the first one. This is so different. Or like moms that have had super traumatic births or, that are wanting to achieve a VBAC, stuff like that.
Well, that can definitely save you money in the long run. It's a shorter hospital stay. I mean, everybody's insurance is so different anymore. And a lot of people are paying for deliveries pretty much out of pocket. So, if you're doing that, then doing this could definitely save you like a C-section cost. That would save you money in the long run for sure. Okay. So I didn't know you guys did stuff postpartum. What can you do? Can you do for our pelvis once baby's out?
So a lot of our moms will go through and there's usually different things going on. So if mom had any separation of her abdominal musculature, we'll go through and test for that and see. And then I can give specific exercises to help get that to heal. If there was any pubic bone injury, if there's any SI dysfunction, like those back dimples, if you're getting pain back there. And then on top of it, you're starting to look down and nurse and do all these new things with baby. So a lot of times moms are getting a lot of upper neck tension. A lot of moms do Quervain syndrome. So when you get that pain in your wrist, because you're holding the baby and doing stuff with the bottles and pacifiers, so we can work with that. And then our office, we also help some moms with some clogged duct issues.
Oh, wow.
Breastfeeding.
Wow. That's amazing. I had no idea. Well, that's super helpful for everybody. Also, I will say that the more research I've done into how a lot of people, like when we push your legs back, especially if you have like a shoulder dystocia, like we push your legs back till they are touching your ears just because we're trying to get that baby out under your pelvic. And I think chiropractic care could definitely help your body just like slip back into place.
Yeah. And I think that that's another thing too. Moms like don't feel it during the whole labor process, whether they had an epidural or, you're just in the moment with all the hormones. So you're not noticing like how high up your knees are going. But a lot of moms will come in and they're like, I have this new hip thing. And I'm like, oh, how are we positioned for this? And then usually you can figure out something like that had happened.
Yeah. Also, just a lot of people are like, well, I had back pain after I got my epidural. And I'm like, but you also had a baby. And it's all like, you have so many new movements that you're doing, like putting the baby in the crib. Don't even get me started on car seats. Like it's just, your body's in a whole new land.
Yeah, it is. There's a lot of new movements happening. So moms, like they'll come in and they'll be like, oh my gosh, like my sciatic pain's so much better, but now I have like this neck thing going on. And I'm like, well, you're looking down a lot more at your beautiful little baby.
Yeah. And then later you've got them on your hip. And then later you're in your bed in the fetal position crying because they're teenagers. Like, all right. This has been so helpful. I have to say that if you were in my town, Alyssa, I would make an appointment.
Oh my gosh. I know. I have to meet you in person sometime.
Yeah. I do need to find a chiropractor that I just like jive with, because I will say that a lot of them give me the heebie-jeebies. I'm not going to.
I know. And the thing is, that's a pretty common thing that we hear. So it's just, you got to find the right person. But I can help you. I'll help you look around a little bit and see if we can find someone.
Yeah. All right. Thanks so much for coming on, Alyssa. I hope you guys got a lot of good information about this and how you can get help. You don't have to feel miserable. I mean, you're going to feel some miserable. You just are. Like, if you're 40 weeks, it's not going to be fun, but maybe your chiropractor can help it make it be more fun.
We can make it a little bit more fun.
Yeah. All right. Thanks for coming on.
Yes. Thanks for having me.
Okay, I love that interview, and I learned so much about what you could be doing to feel better during your pregnancy, because it is those muscles and joints that are so miserable towards the end. And if you took care of them during pregnancy, and especially where she said insurance will cover it, that would be so worth it in my book. So check out a chiropractor in your area, like she said, that does the Webster Technique, and then look at their websites. I agree with that, because sometimes you get a website when it's all about like all these supplements and herbs you can take, and maybe that's not your thing, but there are a lot of really good ones out there. I know that we've had a few in the area where I practice who really turned a lot of babies, and that is so exciting to me. I love it when we can avoid a C-section. So thanks for coming on, Alyssa. I hope you guys enjoyed this episode. Do not miss next week's episode. I am having my lawyer to come on to talk about negotiating with kids, and it is so good. So definitely stay tuned for that one next week. Thanks so much for joining us on today's episode. We know you have lots of options for your ears, and we are glad that you chose us. We drop episodes weekly, and until next time, we hope you have a tangle-free day.